So what we've got for you now is a tale of two clinics. So we're going to go through one clinic, our Palo Alto Family Medicine clinic, who's been really successful with integrating the decision aids into their everyday workflows, and another clinic, the Palo Alto Internal Medicine clinic, who really has kind of fallen flat with those efforts and has not really embraced the concept of shared decision making or the decision aids themselves. So on the left here you can see our clinic champion in family medicine, Monica Diaz, and she's sitting there in one of the exam rooms, and there's one of our posters behind her, and she's holding the decision aid packets that are in every exam room. And by her feet you can see the drawer that's a clearly marked drawer that is designated for the decision aids, and that is also in every exam room. And then in contrast you have the sort of bare looking internal medicine exam room, since they really haven't wanted to use our materials that much. Now, just to get us started, this is a graphical overview of how these two clinics have developed over time in terms of the number of decision aids they've given out. And so, as you can see, the blue line is family medicine. They've had a lot of activity, and the flat line along the bottom is internal medicine. So we'll talk a little bit more about what exactly is going on there, but at first I'll just give you a little bit more background on the two clinics. So as far as size, family medicine and internal medicine are both about the same. They have about the same number of physicians and staff, and they're also located in the same main building at the Palo Alto main campus. And so, as Dominic mentioned before, we worked with the clinics to kind of tailor the program to what they felt was most relevant to their patient population. So the family medicine clinic chose the back pain topics and later added colon cancer screening and advanced directives, while the internal medicine clinic chose hip and knee osteoarthritis to start out. So, and as we've talked about yesterday, as far as relational coordination, we've really seen that play out in these two clinics too. So the family medicine clinic has a really engaged and invested physician department head, and also a really engaged physician or clinic champion for our program. And together they really have created a really cooperative department that focuses a lot on their team relationships and working together and focusing together on providing the best care for the patient and embracing all kinds of new initiatives that the organization puts out. And on the other hand, we have the internal medicine department, which really has been known to have fractured relations within the department, and we were not able to identify a clinic champion who would sort of take charge of the project for us and serve as our point of contact with that. And additionally, within the organization as a whole, the internal medicine clinic has been known to have the reputation for being sort of uncooperative prima donnas who don't really want to embrace any new changes or start out using new initiatives for patient-centered care. And so for family medicine, they chose to have the decision aids in all of the exam rooms so they would be readily available and easy to provide to the patients right when they're in the exam room. But internal medicine felt that they would not have any space for that and really just said no right away, and instead preferred to refer them out to the Community Health Resource Center to pick it up after their appointment. So what we've also seen is that in our family medicine clinic, there's been a lot of continued program promotion from our clinic champion and sort of motivation among the staff and physicians to continue participating and providing the information to all the patients. And as Sukatra mentioned earlier, our clinic champion Monica had these Health Flicks Fridays where she would go to every physician and say, here's a movie for you to watch over the weekend. We have back pain and colon cancer, you can take your pick. And what she also did, which was probably the most important thing, is she actually included participation in our program in her staff's annual performance reviews that contribute to their merit increases. So she let us know that she really feels that it's important to participate in shared decision making and really wanted her staff to know that this is here to stay. This isn't just some fleeting program, because she really feels that shared decision making is the way that healthcare is going to go in the future. But on the other hand, we really have not had a lot of success with raising awareness in internal medicine despite our efforts to, promote our message and our program and let them know about what materials we have. And there so far has only been a really limited number, maybe 2 or 3 physicians in the entire department who have actually referred someone to the program at all. And so now we'll just show you an example of what our clinic champion Monica has done to help maintain awareness in her program. So this is the content of an email that she sent out when our program first launched there. So she had this really colorful email with pictures that she took of where the materials are and what they look like. This yellow card on the side of the computer monitor is a little list that says what the programs are, what's available, how to give them out, and those are attached to every computer monitor in the exam rooms to sort of remind them constantly about what's there and that they can't give them out to patients. So the next thing here is the contest, which we mentioned before. So this is a really large poster that's in a main hallway in the family medicine clinic. So any physician or staff member or patient walking by can see this. And so basically this tracks the progress of individual staff members. And so they get a point for each decision aid they give out to a patient along with their physician and healthcare team. And so when they reach certain numbers of points, then they get some of our partners in medical decision-making prizes that you have there on your table. So they really got engaged with that and had a lot of fun and felt really good about being able to provide something useful to the patients, but also that they felt really proud when they got to stick a stamp, or in this case a lifesaver, above their name, and sort of engaged them together with their team, and also just had a lot of fun and got to have a prize along with that. So here's the same graph that we saw earlier that depicts the different trends in the 2 clinics. And so what we've done here is we've added a few major markers of events that we've done with the clinics that are separate from the usual academic detailing, just regular check-in visits to maintain the program. So we can start out with the family medicine line, which is the blue line here. And so in the beginning of the program, we held a DVD viewing session to kind of help let the staff and physicians see the program, and they could pop into the break room and watch them, have some food, ask us any questions they had about it, and kind of get a feel for the materials. And so that led to a pretty steep incline there, which led up to our back pain contest, where we had a contest for the 4 different back pain topics that the clinic was using, and that led to this first spike you see there, after which things sort of leveled off as they got used to giving out the decision aids. And then last November, the organization had their first ever involuntary layoffs in the company. So the morale was pretty low and they had a little dip there. And then after that, things sort of went back to their normal level of distribution and they felt ready to add some new topics. So they added colon cancer screening and advanced directives, and we held another DVD viewing session, which had that little bump there. And then finally, most recently, we had a colon cancer screening contest to increase the uptake, since not all the physicians were aware of that one, even though we had the DVD viewing. So that worked out pretty well. And then if we turn to the red line with internal medicine, you can see we did have a lot of the same tactics that we used in the family medicine clinic, but that really they didn't enact or inspire any change at all. So the first thing we did was a DVD viewing session with breakfast, the same way that we did with family medicine in our other clinics, but that really led to no change there. So we tried to create these prescription pads to facilitate the referral of the patient to the Community Health Resource Center to pick up their decision aid, as well as brochures and flyers in all of the exam rooms, and that also had no change. And then, so instead we tried to target the patients in the waiting area with more promotional materials to try to get them to ask themselves, but that also led to no change. So as you can see, we've had a lot of variability in our success with the implementation, depending on where we were and who we were working with. But you can see that implementation can work in a clinic culture that is open and receptive to these changes.